One other thing I think when we're talking about people who have an immune system that's not as strong and the risk to them in our community and vaccination, one of the things that we've seen happen now is there's this recommendation for a third dose, right? Because we know people whose immune systems aren't as strong, that they might need another dose to really make sure they've had the same boost effect that the rest of us have had. But it seems that there's a lot of confusion about this third dose that's being recommended for people that are immunosuppressed versus a lot of the talk that we're having about a booster dose coming out later for the whole population. Could you just help explain what's the difference between the third dose and the booster and why that's important that we kind of understand that?
Yeah, absolutely. And you hit the nail on the head where the certain individuals who are either on immunosuppressive medications for things like autoimmune disease or cancer, or who have uncontrolled HIV or things like that, don't necessarily have the immune response that someone else who doesn't have those conditions would have. And so right now the current guidance is for people who are on high doses of these immunosuppressive medications or other immunocompromising conditions that we are encouraging those specific people to receive a third dose. In the coming weeks, we're expecting that there's going to be new guidance coming out recommending for a booster dose, which would be more for the general population. There are some studies out there that are suggesting that the antibodies that you get from receiving the COVID vaccine start to reduce after the first 6 to 9 months. And that may mean that those people who had the vaccine longer time ago don't have that same kind of protection that they did when they first received it. Those same studies do indicate that receiving a booster dose caused them to regain a more robust immune response again. And they're thinking that will be longer lasting and will protect them from further infections.